few more people in the waiting room, so give me 2 seconds and we'll be ready to get started.
Yes, can start.
One second. All right, good morning, everybody. My name is Ankit Bharat. I serve as the Chief of Thoracic Surgery for Northwestern Medicine. Dr. Garza, Rafael Garza, who's one of my colleagues, is here as well, joining us to talk about an important milestone in lung transplant. Recently, we successfully performed transplant using lungs from a donor that had previously been diagnosed with COVID. And this patient had mild to moderate symptoms. But the patient did recover and then ultimately died of an accidental death. So we successfully used lungs from that donor, and then we were able to transplant that in one of our recipients who had COVID-induced lung damage for the last several months and was on the ventilator and needed lungs. So this is the first time, to the best of our knowledge, lungs from a COVID donor have been used in the United States. We think it's an important milestone because, as of yesterday, there were over 30 million cases previously being diagnosed with COVID. And if we exclude those patients from organ donation and lung organ donation, there'll be a substantial gap in our supply demand. So by carefully assessing these donors, we think that lungs can be used from these patients who have a history of COVID. So we are here to talk about that a little bit. The recipient's doing really well, on track for full recovery, still in the hospital for the time being, but we expect that the patient will do really well. There is no evidence of any reactivation of COVID in our recipient so far. So we are happy to talk to you about this and answer any questions.
Maybe can Dr. Garza explain what happened in Spanish? Can you do that?
Yeah.
Okay.
Okay.
Go ahead, Dr. Garza.
Hola, buenos días. Soy el doctor Rafael Garza Castillón, cirujano de tórax de Northwestern, aquí con el doctor Ankit Bharat, quien es el jefe del departamento de cirugía torácica, compartiendo que recientemente hicimos un trasplante pulmonar de un donador que había tenido COVID-19 hacia un receptor que también lamentablemente había tenido COVID-19 severo. Vamos a explicar cómo se realizó esto, qué medidas de precaución tuvimos y el paciente ahorita está pues con buena evolución postoperatoria. Vamos a contestar preguntas al respecto. So we're going to wait for them to ask questions.
Feel free to ask.
Yes, we have some questions already we have Madeline Buckley at the Chicago Tribune. What were some of the initial concerns with using a lung from someone who had COVID, and how did you decide to proceed?
Yeah, so the two things that we are always worried about in these situations are number one, has the virus cleared? has the virus left the body of the donor, and the lungs don't have any more COVID? And the second is there any significant damage that the COVID caused in the donor lungs? So we have to exclude those two scenarios. So we did that by testing the lung fluid. It's called bronchoalveolar lavage in that donor. Typically, we use the nasal swab for assessment, but then in these particular donors, we believe that you have to test the lung fluid to make sure that the lungs are clear of the COVID. And then also we perform biopsies at the time of procurement of the lungs, and we carefully assess for any structural damage and any lingering effects of the COVID virus. Once those two things were checked, we decided to proceed with the transplant. We also look at the function of the lungs at that time. So we individually take gases from each of the different parts, or what we call the lobes of the lungs, and then we send it for analysis. And once those the gas exchange function of each of the different components of both the lungs is found to be satisfactory, that also adds another layer of safety to the quality of the lungs.
Great. And Diane Patthew at ABC7 would like for you to explain to people how groundbreaking this is for medicine and for those struggling to survive this virus.
Yeah, so there are a couple of things about this. So first of all, as I mentioned previously, there have been so many cases. So as of yesterday, over 30 million cases of COVID have been diagnosed in the United States alone. And yesterday, another, I think about 64,000 new cases were diagnosed. So we are going to see more and more cases throughout the pandemic, and a number of these patients are organ donors, and or they will become organ donors. So by if we exclude all of these patients from organ donation, there'll be a huge shortage of supply. So for that, it's really important that we are able to demonstrate that lungs from patients who've had COVID can be successfully used, and then also develop those guidelines and procedures to make sure it's safe and that our recipients don't have a bad outcome. The second aspect of this is on the demand side of things. So as we are seeing more and more patients who've had COVID require lung transplant, it's going to stress the system. There'll be more an increased need for lungs. So we need to be creative. We need to make sure that we maximize our donor pool. So that's number two. And then the third aspect of this is how do we make sure there is no permanent damage to the lungs that would lead to an adverse outcome. We know that up to 20 to 30% of patients who get COVID, even patients who are asymptomatic, can result in some form of lung damage. So how do we carefully, tease out that, permanent and severe damage, and then prevent any bad outcome in our recipients? So all of those things factor into the importance of this accomplishment. I suspect that we're going to see more and more transplants after the feasibility of this one from donors that have a history of COVID in the past.
Great. And then Elizabeth Gold would like to know if you could explain what type of screening of COVID recovered patients is happening and how you're determining that they're eligible for lung donations.
Yeah, so we carefully look at the history of the donor. We want to make sure that they're far enough out from their diagnosis of COVID. So by our criteria, we look at least 2 weeks minimum, but preferentially at least 4 weeks from the onset of symptoms. And then we make sure they've not been re-exposed to the COVID within the few days prior to the transplant or the procurement. And then we go through the careful assessment, as I mentioned before, making sure that the lung fluid is negative for COVID and making sure there is no permanent damage at the site when we send our team out there for the procurement. We want to make sure there's no damage and the lungs are working fine. The important thing here is in our opinion, although we need more data and we need to continue to learn about it, the important thing is to not just go by the nasal swab. We think it's important that the lung fluid, something called what we call bronchoalveolar lavage fluid is tested to exclude COVID and not just go by nasal swab, because some patients can continue to have COVID in the lungs despite a negative nasal swab. So we don't want to take a chance of transmitting that virus into our recipient. So that's the important thing. Sometimes the barriers that we face is that the donor hospital may not have the testing capability for the lung fluid. Most hospitals now have capabilities to test the nasal swab, but the lung fluid is not available. Testing for lung fluid is not available at all centers right now. So we are working with our different OPOs, organ procurement organizations, as well as our donor hospitals to make sure we address that issue.
And Dave Berner with WBBM would like for you to describe the patient's progress at this point and what the prognosis is for this patient.
Yeah, so our recipient is doing really well. This recipient had COVID early on at the start of the pandemic in May, actually, and then was placed on ECMO because the ventilator was not enough. The patient was on ECMO for almost 4 months and then was subsequently discharged to a rehab vent beam facility, but then just never could come off the ventilator. So he's been struggling for a long period of time since practically since last May. After the transplant, his new lungs are working great. He is on track for full recovery. He just needs to get a little bit more stronger in order to maintain, the movement of the air in and out of his lungs. When patients are on a ventilator for this long, they tend to get very weak and deconditioned. So they need some duration of the ventilator to before they can get strong enough to maintain their respirations. So he's doing good.
And we have some questions asking about the donor, if there's any information that can be shared, and if not, if you can kind of explain why that's not allowed.
Yeah, I'll let Dr. Garza explain some of this from the donor perspective. We are not at a liberty to disclose too much on the donor side. I will say that the donor did have symptoms of COVID several weeks prior to the transplant, but the donor had recovered from it and ultimately died of an accidental death. But I'll let Dr. Garza explain a little bit more on there, and I'll let him describe what he found at the donor site.
Hello, and it's Dr. Barat probably already explained a few of these things. The first thing when we get a donor offer, we have to go over the history, very importantly over the imaging studies, including CT scan, chest x-ray, to make sure there's no contraindication, like a big pneumonia or anything else that would contraindicate lung donation. And also, as explained, we take a look at the oxygen levels in the blood of the donor, make sure that they're at adequate levels. And once we see that those are adequate, we actually go to the donor hospital. We do a bronchoscopy, that means a scope to take a look at the airways, make sure there's no significant secretions or anatomic abnormalities. After that, we open the chest, we take a direct look at the lungs and make sure they're grossly looking fine. And as mentioned, specifically with this donor, she had the history of COVID. We made sure there was no history of severe COVID, meaning she never required oxygen, was never hospitalized, didn't have any evidence of pneumonia in the past. And we took that extra safety measure of taking biopsies of the donor lung. Slide under the microscope, there was no contraindication or severe lung damage that was observed. So all those safety measures were taking place to make sure there was an adequate donor.
Excellent. And Elizabeth Gold would like to know, how long do typical lung transplants last in the patient, and do we expect the COVID recovery lungs to last the same?
So typically, for us, we've done about 14 transplants for COVID recipients so far. The average duration is about 10 hours per COVID lung transplant. For non-COVID, it takes about 6 hours, at our center, approximately. 6 hours. So clearly it's a much difficult operation. It takes longer because of a lot of scar tissue that we have to cut through. And just, it's just a technically much more difficult operation. Now, the long-term survival, if that's what you were asking, so far, we've had all these patients that we've transplanted, they've had 100% success. They're all doing really well. And we're seeing that the post-transplant recovery in majority of these patients is actually faster than even the non-COVID patients. Again, there is a spectrum, but given how sick they were prior to the transplant, they are recovering quite quickly when the new lungs kick in and they start to work. As far as the long-term outcomes, again, we don't have long-term data right now. So I'll tell you is just speculation and based on what we've observed so far. The 30-day outcome or survival is 100% of these patients. If you look at the national cohort, the SRTR, which is the Scientific Registry of Transplant Recipients, the 30-day outcome for all transplants is about 97.5% or so. So at least in the near term, I can tell you that their outcome is no different. And at 6 to 8 months, which is where we are right now, having done the first transplant on June 5th last year, they seem to be at par with all the other transplants that are conducted for non-COVID causes.
And one little housekeeping item, can you both please give your full name, pronunciation, as well as titles once again for our broadcast reporters?
Sure. So my name is Ankit Bharat. It's spelled as Ankit Bharat, and I serve as the Chief of Thoracic Surgery and the Director of Lung Transplant for Northwestern Medicine.
My name is Rafael Garza Castillon, thoracic surgeon at Northwestern Memorial Hospital.
Bien, doctor Garza, no sé si me puede escuchar. Le saluda Iris Berríos de Telemundo, Chicago. Me gustaría hacerle varias preguntas en español, si es posible. Lo primero es, obviamente, por lo que tenemos entendido, este es el primer trasplante donde el donante fue paciente de COVID-19. ¿En qué momento ustedes determinan que un paciente que había tenido el virus puede ser donador o puede ser un donante?
Hola, sí, buenos días. Es buena pregunta. Como hemos mencionado, generalmente pues tiene que haber pasado alrededor de 2 semanas. Nos fijamos mucho en la historia del paciente, del donador, si requirió oxígeno, si fue hospitalizado, si hubo evidencia de neumonía, que en este caso no hubo ninguna de esas. Además, se le hicieron pruebas de hisopado nasal, las cuales fueron negativas, y también se tomaron muestras directas de las vías aéreas, y estas resultaron negativas para COVID, queriendo decir que ya teníamos evidencia que había eliminado el virus el donador. Y la otra cuestión es, obviamente vimos los pulmones directamente cuando estábamos con el donador, viendo que se veían de muy buena calidad. Y también tomamos otra medida de precaución, que fue tomar biopsias del pulmón cuando estábamos con el donador. Estas se examinaron ahí y el reporte patológico nos mostró que no había daño permanente en esos pulmones. Entonces tomamos varias medidas de precaución para poder decidir que estos pulmones iban a ser óptimos para trasplantar.
¿Qué significa esto dentro del mundo de la medicina? No sé si anteriormente habían considerado tener como donantes de pulmones o de algún tipo de órgano a pacientes que habían obtenido el virus. Sabemos que la medicina avanza cada día, pero o sea, no es hasta un año después que ustedes pues toman esta decisión o van más allá.
Sí, incluso como mencionó el doctor Bharat, ha habido millones de personas contagiadas por el virus en Estados Unidos y el mundo. Entonces, cada vez vamos a recibir más ofertas de donadores que en su historial han tenido COVID. Entonces, de por sí ya hay una cierta carencia de donación de órganos disponibles, sobre todo para pulmón. Entonces, esto abre pues una puerta para tener más número de donadores de pulmón y poder trasplantar a más gente que están necesitando un trasplante pulmonar.
¿Nos pudiera decir cómo ha reaccionado el paciente, el que recibió el trasplante?
Sí, el paciente ha tenido una evolución postoperatoria favorable. Lo que hemos visto en pacientes que han tenido COVID severo es que se debilitan mucho con la enfermedad, su cuerpo está pues atacando la infección, pierden mucho peso, pierden mucha masa muscular y entran pues debilitados a la cirugía. Entonces la recuperación postoperatoria pues es larga y requieren mucha rehabilitación física. Entonces él se encuentra en esa etapa de recuperación. Estamos pues tratando de quitar el apoyo ventilador, pero creo que va bien hasta el momento en su evolución postoperatoria.
¿Algo más que le gustaría agregar que tal vez yo no le haya preguntado?
No, pues nada más recalcar la importancia de la donación de órganos, pues recordar que salva vidas, entonces pues todos hay que considerar eso, ser donadores de órganos, nada más eso.
I have another question from Madeline Buckley at the Tribune. She's hoping you could clarify how long the patient was on the ventilator before surgery.
Around May is my understanding. He was on the ventilator before surgery. So he was several months on the ventilator and without being able to wean the ventilator.
Okay, if anybody else has questions, please send them in now. Otherwise, we'll be wrapping up. Okay, I think that's it then. Thank you everybody for joining, and any follow-up questions can be sent to the media team, and I will include contact info in the chat. Thank you, everybody.
Thank you. Have a nice day.